Dear colleagues, first I would like to thank the event managers for the invitation and the opportunity to speak today, and now I would like to introduce our project, which is named eHealth First. This project is an IT platform for personal health and longevity management, based on such technologies as blockchain, artificial intelligence, machine learning, and natural language processing, or NLP. It's probably not a secret that every one of us would like to live longer and live their life maximally healthily, actively, to the fullness. I mean, who doesn't want to live for 100 years, being in quite a good state of health? Next generations, and probably us, may become able to live even longer than that in around 20 years. And the thing is, all of us really have such a wish. But our lifestyles prevent us from making it come true. Our daily routine, great lots of responsibilities, stresses, and even the way the healthcare industry is developing. We live in a country where the healthcare industry development level is quite average. Of course, the local healthcare system is not as developed as such systems in Europe, but it is on a way better quality than, for example, such somewhere in Central Africa. I think nobody would argue about this. And anyway, there is no perfect system. Be it our country or the United States of America or Europe, there is a range of healthcare-related problems everywhere. I'm not going to mention extremely bad cases, but even if we take a look at some stories of success, there is anyway a range of problems that exist, in particular information asymmetry. So what does information asymmetry mean? It means that a patient always knows a lot less than a doctor when it comes to healthcare. They know less than those who provide them with services, and so patients become dependent on their doctors.
Which is why the healthcare industry is quite deformed.
Because patients or insurance companies, on behalf of patients, simply have to pay for services which patients themselves cannot actually assess. It'd be the same thing, just as if we went to, for example, a market and bought, let's say, intended to buy something not knowing anything about its qualities, but the vendor we approached kept recommending us to buy exactly that thing. For example, exactly yellow melons. So, information asymmetry is about the same thing. On top of that, access to personal medical records is a real issue, and many questions may be asked about whether such medical records are always kept. In our country, and in other countries too, there is a problem. In fact, patients have very limited access to their personal medical records. Those are medical records about their health. And for example, in case I move and have to change the clinic I normally visit, my new doctors will have to recollect all the anamnesis and deal with all those piles of documents. That is really not convenient, and all the information that may be useful is lost.
On top of that, it's not a secret that in many countries where so-called social security systems exist, there are such problems as lines and delays when it comes to medical consultations.
Patients may need to wait for up to a month or 2 or 3 until they can be consulted by a highly professional doctor, not actually having any ability to anyhow influence their health before such a period of waiting is over. And that is, once again, absolutely not convenient. Moreover, what is really important today, both in case of our country and the United States of America, is how medical services currently cost. Every such kind of medical services or a range of such medical services is paid for either directly by the patient or indirectly by transfers from insurance companies. Therefore, it is a big problem. It restricts access to healthcare services. And there is another problem, which is not less important, but there's less information on it, because the problem is related to doctors' qualifications. Precisely, this is about doctors' professional education, the knowledge they have, and the same about other specialists who work in the field. And another problem is related to juxtaposing or opposing of so-called generalized and personalized clinical practices. The thing is, this problem is so certainly not very obvious, but is at the same time very, very important. Here is, I can show you with the help of the figures, how many notes are indexed in the PubMed system annually. And this is actually the most famous system of annual biomedical publication of new articles. Please take a look. So every 5 years there's a 25% increase in the number of articles. So which means over 1,200,000 biomedical articles are published annually. Well, it's obvious a lot of them are probably not very important, just like some publication reviews. So not all can be picked. But anyway, that is a great volume of information which, as we suppose for some reason, is learned and eventually used in practice by those who work in the field of healthcare. Anyway, anyone who can think of it would say this is not possible to do. And I've not yet mentioned new technologies. The thing is, biomedical technologies and medicines of new classes are developing rapidly. I can say it is already part of, at least I can say it is getting integrated into clinical practices. However, any information on it gets integrated into clinical practices slowly. It lags very badly, it arrives too late, and I mean the routine already existing, and known clinical practices, and innovative practices too. And what kind of conclusion can we draw? Patients are bound to wait for weeks until they can eventually visit a doctor, and at the same time patients cannot be certain of what level of qualification and education a certain doctor has. So patients have to either pay for themselves or their insurance companies pay for that. Something's wrong with the system. You can say educate doctors better, you need to solve this problem this way, that more clinics and hospitals are open. Unfortunately not. The experience of many countries, in particular the United States of America, has shown that they have in fact hit the glass ceiling of their spending, having around 17% of their GNP allocated for the healthcare industry. In Russia, such spending here is not so significant, but what we have is what we have. Anyway, for some reason, the government is not able to spend more on that. Therefore, there's a question, how can we fundamentally change the system using extensive approaches? And this is a very important thing. Yet good things tend to happen too. For example, according to forecasts, there will be 2.5 billion users of mobile devices on the planet by 2018. Most of mobile devices in the world are actually smartphones. Smartphones are great tools for such serious interaction and finding solutions for many problems. Besides, it's just the beginning yet, and monitoring one's health state with use of some gadgets one wears is already coming into fashion. Besides, what we believe is going to happen is we will soon witness a revolutionary breakthrough in clinical epidemiology, biostatistics, big data, and clinical medicines, since these fields are already at the point of bifurcation, which will allow that to happen. In other words, different fields of science are ready to convergence, is ready for a breakthrough, a technological breakthrough. And a little later, I'm going to speak about artificial intelligence, machine learning, natural language processing. These are the fields that are already on the edge of the third breakthrough. The first two so-called revolutions and the blooming development of these fields have already ended and unfortunately have not produced impressive results. But the world expects new breakthroughs we can achieve with help of those technologies. Besides, many people are genuinely and seriously interested in paying more attention to their health, in being able to use effective instruments when there are many strange and useless ones. But people start understanding that health is a very valuable asset, that the ability to live for not, for example, 60 but 100 years motivates them highly. Telemedicine is developing. We know that this market is going to be legalized in Russia this year, and we will see its rapid growth. We already know that Yandex and Mail.ru are entering this market, sure, along with all the companies. But there is an important nuance here. From our point of view, telemedicine itself, what is telemedicine? It is in fact a distant interaction between a doctor and a patient, in very simple words. This can be done, for example, by means of video calls, and unfortunately also cannot revolutionize and make the substantial improvement to the healthcare industry. Why? I already mentioned it. The number of highly qualified doctors is very small, and the preparation of such good doctors costs a lot. And therefore, as you already know, there will be lines anyway, usual lines or telelines, in case patients want to visit really great doctors. Besides, the best specialists in the field are not really in such need that they would hold teleconsultations, let's be honest. Plus, the blockchain technology, a very important thing. Why? Because today is already transforms technologies in very different fields. And in particular, that relates to healthcare, and our project is probably one of the first 10 such in the world, which actually combine eHealth and the blockchain technology. I would like to say once again that our project is in fact one that is aimed at health and longevity management, and is based on multiple different fields and technologies. In particular, on machine learning, artificial intelligence, blockchain, classical epidemiology, biostatistics, and big data. It's some kind of convergence. The project itself is a kind of convergence of multiple technologies. And I'd like to say it in short. The project, the software, will actually consist of two parts. The first one is the program for personal health management, as I've said already, and I'm going to tell more about it now. And the second one is an open system for specialists working in such fields as biomedicine, healthcare, and biomedical sciences. So what will we see there? A lot of different features on the system. In particular, what will its users get? I mean users of the system of personal health management. First of all, it will allow to conduct screening of a wide range groups of diseases. This means the user will answer questions, enter the data of analysis carried out with laboratory instruments, and the system will synthesize data from popular scientific literature, which is received by, in fact, manual analysis, use of a machine learning algorithm, artificial intelligence, and natural language processing. And on the other hand, with the data provided by the patient. And in fact, such a synthesis will provide each patient with personalized recommendations. For example, the patient will answer a range of questions, enter the data received by analysis, and the system will show which diseases of the patient may be diagnosed, with which probability, and what the patient needs to do in order to complete the diagnosis algorithm. Besides, there will be special modules, a diagnostic one and a recommendation one for patients suffering from chronic diseases. We know that a lot of patients suffer from arterial hypertension. The pathological conditions, I mean, are all simple and very well known, but well known to biomedical specialists, those who work in relevant research fields, not to a normal doctor doing clinical work. Diabetes, metabolic syndrome, obesity, etc., etc., and it sure relates to oncological diseases. Separate modules will be there for all these. Also, the system will let its users to get to know their biological age, but not in the way you're suggested to do it on the internet, by buttons like "Learn how old you really are," which suggest you to answer several random questions. No, it's not about that. In case the system will allow to get to know real indexes and longevity indexes, age indexes too, and the frailty index as well. One of the two inventors of that index is an advisor of our project, and there will also be modules with disease prophylaxis. Well, I would like to mention a range of particularities: telemedicines, data storage and processing in the blockchain. Centralized and decentralized storage will also be performed. But they are all fairly easy to implement. We do not believe that these technologies only will be able to fundamentally change the field of healthcare and be of great value for the mankind. The second system is one for biomedical specialists. Let me tell you about it in short too. What it will actually do is allow one to research through a lot of biomedical publications related to various fields of study and do that in a structured, graphical way. For example, what's the connection of that receptor with the clinical outcome, or how does that group of medicines relate to those adverse events? And this all will be done automatically. We do not say that it will be as effective as if 150 or 200 experts worked in that issue. But we understand that 150 or 200 experts will require a lot of money and time, and there will be a serious lag. So we have lack of time, and I will tell only what will patients themselves to get from the system. First, that will be personal data storage. Patients will enter data regularly, and their data will be protected. Only patients themselves will be able to choose who has access to their data. I mean insurance companies, healthcare services providers, clinics, doctors, or whoever they choose. Then patients will be able to participate in some kinds of research, once again, if they are willing to. Besides, patients will be able to regularly monitor their state of health. They will be able to receive recommendations, have their conditions diagnosed, get recommendations on how they need changes of their lifestyle in advance, which biologically active food supplements to take, etc., etc. As well be provided with the telemedical consultations and learned about the specialists near them, in the local system in their town, county, state, country. And sure, healthcare service providers will also enjoy a lot of benefits, and once again I would like to say that we firmly believe and state that personal data should remain under control of patients themselves, not a corporation. That is a very important thing. Therefore, the system will bring many advantages to healthcare service providers. They can also easily work with this model, software developers too, and sure, we believe that only us who can build the foundation, the range of modules, and this will all work well, but really global things are what we can do together only. That is why an API-based platform will be created. Other developers will be able to create modules too, make profit on them, and let patients use them for free as they wish. Besides, researchers and social institutions, in particular the Research Institute and University, will certainly find it useful too. So will commercial enterprises, as this is one of the potential ways of monetization. But let me repeat once again that access to patients' data is given only after they share their data with a certain organization or a certain researcher, and it may be given not forever, but only in terms of certain projects. And also I'd like to tell about who we are, about our team. Now the team members come from 8 countries and we are 17. By the moment of the launch of a private placement, 5-6 more famous specialists will have joined us. They work in such fields as medicine, biostatistics, clinical epidemiology, big data, public health, artificial intelligence, machine learning, blockchain, and legal matters. In particular, among us are lawyers from the USA and the European Union. We've got people who develop software, managers, in general, a very interesting multidisciplinary team. You will find more information on them in our white paper, which is going to be released in the middle of January. Now you can download the brochure from our website, it is available. You will be able to learn more and about new team members as well. And now we're going to hold a private placement from the 1st of December 2017 to the 17th of February 2018. We invite you to participate in it. You will be able to use bitcoins and ethers, and the minimum amount of investment is a half bitcoin or 10 ethers. These are the minimum amounts of investment in terms of the private placement, and you get a 70% discount in comparison with the price of the first day of the ICO, and that is a large discount. Usually discounts are at 30, 40, up to 50%. And these are the conditions of the pre-ICO, which follows the private placement. And the only thing is, the bonus will be up to 40% of the price on the first day of the ICO. And the ICO itself will be held on May-July 2018. Its dates may change, like 1 month later or earlier. Please check the updates on our website. I will not put an emphasis on what a token holder gets now, because everything is described in detail on the website. If you're interested, feel free to visit it and learn what you get when you buy a token. And please contact us on Twitter, Facebook, LinkedIn, or any other way you prefer, Telegram maybe. We will be happy to hear from you, or write an email to us. This presentation will be public. Thank you for your attention.